This presentation is not intended nor approved for use as a continuing education course for dental health professionals or a course for certification in coronal polishing. This presentation will discuss the overview of dental stains. We're going to look at the identification of stains, the etiology, the classification, clinical appearance, distribution, and occurrence. So how do we identify stains? Well, one is by clinical presentation. What does it actually look like? What kind of characteristics? And then we need to know the name of the stain. There are many common dental stains, which we will look at by title only in the next slide. And also a dialogue history with your patient, because sometimes teeth may present two possibilities of the type of stain or the etiology of the stain. And while we cannot diagnose as dental assistants, I believe that's true in any state, especially in California, but we need to be able to identify them. So asking the patient about their dental history can help us determine the type of stain that the patient has. Here are the names of some very common dental stains. We have yellow stain, green, black line, tobacco, which is also can be brown stain, coffee stains or brown stains, orange stain, non-vital staining from non-vital teeth, tetracycline stain, fluorosis, dental treatment, imperfect tooth development, and we also have stains that we see from trauma. So this presentation does not have clinical views of these stains, but if you go on the internet, there's lots of photographs that you can see these common types of dental stains. And if you're a student of mine, you do have a handout and your textbook with clinical photographs of common dental stains. The etiology of dental stains. So the etiology is what causes these stains. Some stains are caused by chromogenic bacteria. So these are bacteria that give off color, such as orange stain could be from a chromogenic bacteria, black line stain, another stain from chromogenic bacteria, or sometimes yellow stain from food pigments, which we'll see down here. Medications, tetracycline stain is a stain that is caused by medications. Food pigments, so sometimes people eat certain foods, maybe drink wine, have tea, coffee, can cause staining, such as yellow stain, brown stain, are some of the stains caused by food pigments. Disturbances in the formation of enamel and dentin. So these can either be congenital or genetic, and these are stains such as amelogenesis imperfecta or dentinogenesis imperfecta, or enamel hypoplasia. Dental treatment can cause stains. So if you have a tooth that has a really large amalgam, the teeth sometimes have a blue or grayish hue to them. If a tooth has had endo treatment, the tooth can discolor into a grayish tone or a brownish tone. Or if a tooth has had trauma, so if somebody gets bumped in the mouth and the pulp becomes non-vital, that will discolor the tooth. Again, kind of a gray, can be in the brown tones of causing a appearance to the tooth of a discoloration. Stains are classified as either endogenous or exogenous. Endogenous means that the stain actually developed as the tooth in the tooth structure as the tooth was developing. So examples would be tetracycline stain as the tooth is developing, amelogenesis imperfecta as the tooth is developing, dentinogenesis imperfecta as the tooth is developing. and these stains are not removable by coronal polishing. Exogenous stains occur after the tooth has developed, and they can either be extrinsic on the surface of the enamel, in which case they are removable by coronal polishing, or intrinsic, they're in the tooth structure and cannot be removed. So extrinsic stains would be your very common yellow stain, green stain, black line stain, tobacco or brown stains, orange stain, quite a bit of different stains that can be removed by polishing. An intrinsic stain caused after the tooth has been developed would be staining from dental treatment, like the amalgam, or the enamel is discolored because of endodontic treatment. So those would be examples of staining that are in the tooth structure that we cannot be removed by polishing. The appearance of the stain. Definitely there are various colors of stains: yellow, orange, brown, gray, blue hue that we see. They may have different patterns, like tetracycline has a striated pattern, so you have like different layer looks of color. And then teeth may have different textures, as in amelogenesis imperfecta or dentinogenesis imperfecta, where there is loss of enamel, more dentin showing, and so they not only have color and pattern, but they may have pitted enamel, like little indentations in the enamel. Or it looks like it has little rough surfaces on the surface of the enamel. Distribution has to do with the tooth surface that these stains or discolorations are covering on the tooth. So our tooth surfaces, I think you all know tooth surfaces, or tooth areas. Sometimes the division of thirds, is it at the gingival third or the middle third of the tooth, or the incisal third or the occlusal third, or is it in the tooth embrasures? So that would be descriptions of the distribution. The occurrence of stains deal with the affected population. So sometimes we see certain types of stains associated with men, some with women, some with children, some with all. So depending on habits, certainly smokers stain, men and women smoke. Women and children, black line stain tend to affect them more than men. People who use tobacco or drink a lot of tea and coffee, that would be an occurrence in that population of people that use or drink those particular drinks, or if they have habits such as smoking, chewing tobacco, again sadly drug habits, that would be the population that would be affected. So why is it important to recognize stains? As an RDA in California, if we're asked to coronal polish, it's important that we recognize whether a stain is extrinsic or intrinsic. You don't want to be burning up a tooth trying to polish away a stain that is intrinsic. Also, we have to determine the amount, the type of polishing agent. So does this stain require just a fine polishing agent or abrasive, or a medium or a coarse abrasive? So the type of polishing agent. That is the end of the presentation on recognizing dental stains in association with coronal polishing, and I thank you very much.